I'm the practice manager with the physician clinic here at Carolina's Rehab Mount Holly. I've been here for about 7 years. The careers that we have here are, they're of course the physicians and PAs that take care of the patients, and for them, the education is, of course, they have to have a bachelor's degree, then they have to have a doctorate, then they have to go through internship and then residency. We also have front desk folks who check our patients in, check our patients out, make appointments. That requires a high school education, and then they have to be able to, all of our staff has to be able to function with an electronic medical record, and then they also have to be able to manage our systems that for scheduling appointments, that sort of thing. I also manage the radiology and the ultrasound departments here, which are also another alternative for folks. They require a 2-year degree, and then you get certified either in radiology or ultrasound. We see patients when they're discharged from the inpatient unit, whether they've had a stroke, whether they've had a spinal cord injury, maybe they were just maybe they had COVID and are what we call debilitated. They just don't have the energy and the ability to function. So we see them in the clinic to make sure that they're recovering in the way that we want them to and the way that they want to. And then also determine how are they doing with therapy. Do they need some more physical therapy, occupational therapy, or speech therapy? And if they do, the doctors will order that. We also see patients who have had amputations. We work very closely with their prosthetist. We also do Botox injections, not for aesthetics, but for treatment purposes. So we do it for patients who have had a stroke. Maybe they have CP or MS, something like that, and their muscles are just not what they need to be able to function in their world. So we do the Botox injections, and it makes them be a little more independent in their life.
I'm the general manager here at Mount Holly Hospital. I am in charge of food service. I am director. I control everything from the patient food and the care to the cooks that cook the food, also to the kids who deliver the trays and everything like that. So we do have a lot of different equipment and machinery in the kitchen, from different steamers to fryers to different things like that. We do offer training to all of our chefs, all of our frontline staff, to help them be able to be successful in each area that they work in. We do have certifications for our chefs. They are all Serve Safe certified, so we all have to go through that training to make sure that we can pass all of our inspections and things here at the hospital. We do have a lot of internships that we have. That is one of the things that we do offer. I actually had the opportunity to be an intern at the hospital before at CMC Maine, Carolina Medical, now known as Atrium Health. I was there for about 12 years. We come from Johnson & Wales. We partner very well with Atrium to provide students the opportunity to get some access to our field, to learn some different things before you get in that industry.
I am a registered nurse. I started 14 years ago here as a nurse and have worked my way up, and I'm now a clinical supervisor on a rehabilitation unit. To be in the position I'm in, I do have to have a bachelor's degree, but my staff nurses are all, for the most part, associate degree nurses, RNs. The level of care we give, we only have RNs or higher. We don't have LPNs in this level of care. But I had to go back later to get my bachelor's to get the position I'm in. In high school, I did go to what was called then the School of Technology in Lincoln County, and went every day for a period or two, I think, and I did get my CNA in high school. So by the time I was out of high school, I was able to go straight and work on my prerequisites for my nursing degree to apply to nursing schools sooner. So in rehabilitation nursing, it's a different type of nursing on its own, where we're acute care still, so patients do have to be sick enough to be in a hospital and need 24-hour RN care, IV blood and antibiotics and things like that. But they also have to be well enough to tolerate 3 hours of therapy a day. So each patient does do 3 to 4 hours of therapy a day, broken up throughout the day, and it takes a lot of organization for us as nurses to work with therapy. A huge team approach to medicate, to talk back and forth about what's going on with the patient. They're having these symptoms, or didn't